Hi, this is Dr. Steve Jones at Fern Chiropractic here in Louisville, Kentucky, and today's topic is degenerative arthritis. A lot of patients I'll have will come in and they will ask me, can you help with degenerative arthritis? And chiropractic is one of the most effective treatments for degenerative arthritis, and I'll explain why. But the first thing I want to talk about is other types of treatments for degenerative arthritis. The first one I can think of is drugs. And it's typically what you'll receive when you go to your medical doctor with arthritis pain. Now there's obviously a number of different analgesic drugs, including ibuprofen and aspirin, but one that they've used more frequently in the last few years are COX-2 inhibitor drugs like Vioxx and Celebrex. And what that does is it tries to treat a protein that you exhibit when you have degenerative arthritis, and tries to deal with the pain in that way. Now, there are a lot of risk of drugs, especially COX-2 inhibitors, and a lot fewer people are being prescribed them because of the risk of cardiovascular symptoms. The second treatment that doctors will employ is surgery. And you may have been told that you need to have surgery. And very often, when we talk to our patient who's been told that they need to have surgery, we very often can find avenues for care within chiropractic that can help them, hopefully keeping them from having to undergo risky surgeries and lengthy recoveries. Now, all surgeries can't be avoided, but I just want to let you know that there are obvious risks with surgery, and I think before you go that route, it's always important to not only get two different opinions, but to try other things first, because very often once you've had that surgery, you can't take that back. So finally, chiropractic. And one thing I've noticed about degenerative arthritis is that the only time that you see degenerative arthritis, there is generally a very obvious malfunction that's going on in that joint. Now that is not just in the spine, but in the elbows and hands and wrists and knees. Very often when you take an x-ray, it's pretty obvious why a joint is worn in a certain manner and why degenerative arthritis seems to afflict a person in a specific way. So a good chiropractor will take that information and make a joint work much better. And when it functions much better, not only can you avoid having further arthritis symptoms, but you can very often deal with arthritis pain in a way that drugs cannot do. What you end up is with a real lasting solution to arthritis pain, because you're actually improving the quality and the function of that joint, and nothing works better than actually improving function. So if I can be of any further assistance or you have any other questions for me, please call me directly at the office. I'll be glad to talk to you personally. Have a great day.